Hello, I'm Nadeem Aslam. I'm an orthopedic consultant specializing in knee injuries, knee and hip surgery. I'm the leading robotic surgeon in the United Kingdom. I would like to talk about hip replacement surgery, the benefits and the risks. The benefits of a hip replacement are that your pain will be improved. It will also improve the movement in your hip. You'll be able to walk without a limp, you won't have the severe pain in the groin, and it will dramatically improve the quality of your life. The risks. Although the risks of surgery are reduced by robotic surgery, there are risks with such surgery. A serious risk would be infection. There is a risk of 1 in 100. An infection in the joint is a very serious problem. A superficial infection can be treated with antibiotics. A deep infection involves washing the joint out, and in some cases the joint has to be removed, antibiotics given for 2 to 3 months, and the joint has to be redone. Next, thrombosis. Thrombosis is a risk. Blood clots can occur in the veins. Therefore, nowadays we encourage enhanced movement, quicker movement after the surgery, stockings and injections to reduce the risk of blood clots. Next, in a hip replacement, sometimes there can be a difference in the leg length. If at the time of surgery the hip is loose, the leg has to be made longer to tighten the hip up. There's a 2 to 5% risk that the leg may be slightly longer or shorter. Dislocation. In an extreme position, the hip can dislocate. So we do have dislocation precautions in some patients, especially if they have neurological conditions. Next, with our minimally invasive surgery and robotic surgery, we minimize the risk of dislocation to less than 1%. Next, nerve injury. There are a small number of patients, around 1%, who can have an injury to the nerve. The usual method of injury is stretching the nerve or touching it, and it can go to sleep. This is known as a neuropraxia. This can either cause weakness in the foot, which is a foot drop, which may require a splint, or it can cause weakness in the quad mechanism, which means the knee may feel as though it's weak on walking. These usually recover. The recovery is variable. In our experience, the recovery is within 6 weeks in around 60 to 70% of cases, and some cases can take a few months. There is a risk with any joint replacement of wound problems, although we try to minimize these by carrying out a cosmetic suture and thoroughly washing out the joint. There is a risk of the joint not taking or failing and leading to further surgery. This usually happens in patients who have poor biology, such as diabetes, are on steroids, or have significant rheumatoid problems. The majority of patients after a hip replacement do well. It's one of the most successful procedures with a 90% success rate. We do everything that we can to improve the quality of care, and we see patients throughout the pathway to pick up these risks earlier. Thank you.